Hi, I'm Dan Cullinane. I'm one of the trauma surgeons here at Mayo Clinic. I've been on staff here for 12 years and over the years have taken care of a number of injuries from deer stand falls and as well as hunting related injuries. I'd like to talk a little bit today about deer stand injuries since the hunting season is coming up shortly, and in part how to prevent some of these things and some of the injuries that we typically see from a deer stand fall. Deer stand injuries we see every fall. We see several of them, up to about a dozen during the hunting season. Often what happens to some of these folks is people get up very early to go hunting. They get tired, they fall asleep and fall out of the deer stand. That happens quite commonly. If they're not strapped into their deer stand, they fall and hit the ground and they can be badly injured. Some of the injuries we see, head injuries are quite common, as are spinal cord injuries. In addition, we also see a number of people who have fractures of their extremities, arms and legs, and sometimes even rib fractures can occur. Many of these injuries can be life-threatening, and particularly if the victim falls and is left in the forest for a long time, injuries that may not be life-threatening can certainly become life-threatening. I think it's important to, when you're going hunting, obviously you have to wear your blaze orange if you're hunting deer, and that it's certainly cut down on the number of gunshot injuries that we see, but we still see a large number of falls from deer stands that are either improperly put up or in situations where people don't have their harnesses attached. I think it's important to let somebody know where you're hunting, particularly if you're hunting alone. It's always better to hunt with at least one or two other people where they know where you are, and you can check back frequently with each other so that if there is an injury that occurs, you can get treated in a timely manner, and hopefully minor injuries won't become major injuries due to a time lapse. I'd like to stress to our regional trauma community here in Minnesota that hunting injuries do occur quite commonly during the fall season. It's important to, if you are hunting, to let somebody know where you're hunting and to hunt in groups if at all possible. I'd like to stress also that time is of the essence with traumatic injuries, and getting the patient to a trauma center in a timely manner can help minimize the impact of these injuries on the patient's life. One of the things that we do see occur on occasion is when people fall from a stand and they go home rather than getting seen in the local hospital or in the trauma center. And I think that's generally good to avoid, because if you have taken a good fall, we have seen people with delayed presentations of concussions, and particularly with some of the neck injuries that can occur with a fall. And these are things that are best treated in a timely manner, and obviously the outcome will be better the sooner we can start treating the patient rather than a delayed presentation a day later when things are getting, when the patient's deteriorating.